Retinitis pigmentosa, the short form RP, is really a very serious eye problem. It is a degenerative disease of the eye, especially retina, and it is capable of leading to total blindness. And another thing, it is congenital in its onset and also genetic. It is proved to be genetic. So, when a patient or a parent of a patient come to know that it is the disease is diagnosed as RP, they become not only afraid, they become panic in a way or other, because it is a genetic problem and capable of leading to blindness. Both are very serious issues. So the patient has to approach the case with what I will say, very with a calm mind and with a bold mentality. Then only we can fight against it. Really, I will say it is a fight against the disease, not a treatment. So, in my experience, I have seen patients hiding the term RP. They will be simply saying some symptoms, night blindness, or some these field defects, like that they will say. But later we can understand they are fully aware of the disease and they are well educated with this condition. Still, mentally they are not prepared to accept the disease. That seems to be very dangerous situation. I will say, as a doctor and as a experienced person, I will say the first step of the treatment should be to accept the condition. Then only we can think what to do to overcome it or what to do to fight against that. Because it is a problem of future, it is a problem of sometimes life and vision. So, very carefully we had to handle it. The range of the symptoms are very wide, and the time of onset also is different in different individuals. In some cases, the symptoms will be seen from very childhood age, from 6 to 10 years, and I have seen patients who are developing these symptoms only after the age of 20. So, since it is a degenerative condition and progressive in nature, the theory of the treatment is to start it as early as possible. Don't waste a single day or a single minute to start the treatment, because the degenerative process is continuing, it is progressing, and it will end only in blindness. That is the natural course of the treatment, but of the disease. But this will happen only if nothing is done as treatment. Now we are interfering the disease with the treatment. How can we approach with the medicines? That is the most important thing. Already I told to accept the disease. That is the most important thing, and understand what is the clinical stage at that time. There are different stages also for this disease, and in different stages the symptoms also will be different and different, sometimes adding one after another, like that. So in Ayurveda, in different stages of the disease, the symptoms are different, so the mode of treatment also will be different. Here there are so many things to be considered. First is the nature of the patient, that is, we will say in Ayurveda, Prakriti, the body constitution of the patient, and the hereditary background, and the habits, food habits, and other habits of the patient, and most important, the mental status and mental stability of the patient. All these are equally important while handling the disease as a treatment. So, first of all, we have to think what is the age and the clinical stage of the patient. On that basis, we will start the treatment. So, the result or the aim of the treatment should be to arrest the progress of the disease if possible, or at least delay the deteriorating process. In my experience, these are possible. That varies from person to person, and also the clinical stage I have already explained. So, simply saying to cure the disease, that is not a good thing. It is not possible because it is genetic and by birth problem. To cure completely, it is not possible, but it is treatable. It is manageable. Anyway, something is better than nothing. We can do something to protect his vision, or prolong the vision, or increase the this age of the patient with vision. Like that, so many things we can do. But it is not a single eye drop or a tablet like that. It will be a management, and it will be a long standing process. Sometimes we can say lifelong, just like diabetes or hypertension. The patient has to manage the disease with the medicine. Like that, some disease in the eye also is in such a situation that can be managed with the medicine. It will be a long standing process of treatment. Like that, RP also can be managed with the medicines. And the overall aim of the treatment is to improve the functional capacity of the existing or remaining cells of the retina, and that will give anyway subjective level improvement in vision. If the patient is cooperating in a good way and following the instructions and mentally stable or educated enough to face the disease and to fight against the disease, then the result is guaranteed. There will be some betterment anyway. In my experience, from my I can say like that. But if the patient is too much worried and panic and always blaming even God, I have seen why this is happening to me, and I have done nothing wrong, and like that, blaming everything, and not ready to accept it or to face it, then the result will be less, because the mind and his brain, everything is turning face against. Instead, if they are following the treatment with a good cooperative level, they will get result, that is sure. And this treatment will be anyway, there will be hospitalized level treatment, very systematic, very theoretical mode of treatment procedures are there. It will be a hospitalized inpatient level treatment. There will be different these stages in the treatment, step by step, consciously, with confidence. If we are doing the treatment, that can be arrested to a great extent. But the age of the treatment while starting the treatment, that also is very important, because there is a physiological pattern for the any individual. Up to 20 years it is in a sharp growing stage, then 20 to 40 it is most often stable, and after 40, 45 like that, there will be declination in the level of functions. Degenerative changes starts. In the eye, it will be reading problem for presbyopia or graying of the hair, like that it will start. So in that stage, if there is a degenerative disease already existing, that will flare up. It will increase in its intensity. So it is better to start the treatment as early as possible with good aspect, this what I will say, cooperation and food restrictions and mental stability. If we are following the treatment, we can expect good results. No need of be panic about being blindness and other things. There are treatments in Ayurveda, and it can help the RP patients to a very good level.